Okay, if you have diabetes, I need you to listen really closely. Your kidneys, they're absolute powerhouses, filtering almost 200 liters of your blood every single day. But high blood sugar can silently, and I mean silently, cripple these amazing organs, often with zero symptoms until 80 or even 90% of their function is just gone. By the time you actually feel something is wrong, it might honestly be too late. But here's the most important thing I'm going to say. When you catch this damage early, its progression isn't just preventable, it can often be stopped right in its tracks. So first, let's just get a sense of the scale here. We're talking about 20 to 40%. That is the percentage of people with diabetes who will, at some point, develop chronic kidney disease. This isn't some rare thing. It's a very real, very common risk that everyone living with diabetes has to face head-on. And that is why this is so critical. You see, diabetic kidney disease isn't just a cause of kidney failure. It is the #1 reason, the leading cause that people end up needing dialysis or a kidney transplant all across the globe. And it all starts quietly, hidden behind that diabetes diagnosis. So let's make this personal. We're calling it a silent threat for one simple and frankly terrifying reason. You just can't feel it happening. There is no pain. There's no alarm bell your body rings while the damage is being done. And this slide right here, this really brings that global problem right down to a local level. This data from India shows that almost 1 out of every 3 cases of total kidney failure is a direct result of diabetes. This isn't just a statistic, it's an urgent health issue that impacts real families and communities everywhere. I really want you to let this sink in, because this might be the single most important fact we talk about today. 90%. You could be walking around, feeling totally fine, living your life, while having only 10% of your kidney function left. This is exactly why we can't. We must not wait for symptoms to show up. All right, so how does this invisible damage actually happen? Well, it's not a sudden event. It's a slow, quiet process that builds up over years, completely under the radar, attacking the very heart of your kidney's incredible filtering system. Okay, I want you to picture this. Each of your kidneys is packed with over 1 million tiny, delicate filters. They're called nephrons. Now, high blood sugar makes your blood thicker, kind of stickier, and that scars and clogs these little filters. And at the exact same time, high blood pressure, which so often goes hand in hand with diabetes, acts like a little jackhammer, just pounding away at these fragile structures. It's a two-pronged attack that, over many years, just wears them out. And this whole destructive process isn't an overnight thing. It's a really slow burn, happening over a decade, maybe more. The damage kicks off early on, but look at that critical point around year 5. This is our golden opportunity. It's the testing window, where we can spot the very first signs of trouble, years before any symptoms might appear around year 12. This window is our chance to fight back and change the outcome. And when those signs finally do show up, this is what you might see. Swelling in your ankles, maybe your face. Urine that looks foamy. A kind of fatigue that's so deep in your bones you just can't shake it. But let's be crystal clear about this. These are not early warning signs. These are late-stage alarms. They're screaming that significant and often irreversible damage has already been done. Okay, that's enough about the problem. Let's shift gears and talk about the solution, because we have a powerful early warning system. And you know what? It's not complicated, it's not expensive. It all comes down to 2 simple, absolutely essential tests that you need to know about and, more importantly, ask for every single year. You see, the very first clue that your kidney filters are starting to get stressed out isn't something you feel at all. It's the leakage of tiny amounts of a protein called albumin into your urine. The medical term for it is microalbuminuria, and it's basically the canary in the coal mine. It's the first distress signal your kidneys send out, and you can only find it with a specific test. So, here's what your annual checkup has to include. First, a simple urine test called a UACR. This one looks for those tiny protein leaks we just talked about. Think of it like checking the filter for holes. Second, a blood test called the eGFR, which stands for Estimated Glomerular Filtration Rate. This test basically measures the overall horsepower of your kidneys. A healthy eGFR is up above 90. If that number drops below 60, that's a red flag for at least stage 3 chronic kidney disease, and that's when we really have to get serious about protection. You need both tests, the leaks and the power, to get the full picture. So when should you start? Well, the guidelines from the American Diabetes Association are crystal clear. If you have type 2 diabetes, you start screening the moment you are diagnosed, not a year later, but right away. For type 1, you begin 5 years after your diagnosis. This isn't just a friendly suggestion, and you have to be your own advocate here. A lot of doctors will remember the blood test, but forget the crucial urine test. You have to insist on getting both done every single year. All right, now that you know how to find the problem early, we get to the most empowering part of all of this, the battle plan. This is your proactive strategy, your way to protect these vital organs for the rest of your life. It really boils down to 4 main pillars. Number 1, get that blood sugar under control. We're talking about an HbA1c, that's your 3-month average sugar, below 7%. Number 2, control your blood pressure. The target is under 130/80. 3, you've got to ask your doctor about specific kidney protective medications. And number 4, be so careful with over-the-counter NSAID painkillers like ibuprofen. They can be really tough on your kidneys. I really want to pause on this for a second because this is so important. While blood sugar gets all the attention with diabetes, getting your blood pressure under control is, you could argue, just as important, maybe even more important, for protecting your kidneys from that constant physical stress we talked about. Please do not overlook this. And just look at the amazing tools we have in our arsenal now. Medications like ACE inhibitors and ARBs are proven to protect the kidneys by helping to relax the blood vessels. And this newer class, the SGLT2 inhibitors, wow, these are a total game changer. They not only help with blood sugar, but also directly reduce the pressure inside those tiny kidney filters. This is a conversation you absolutely have to have with your doctor. So we've talked about the threat, how the damage happens, and the plan to protect yourself. Now let's pull it all together. How do you take all this knowledge and turn it into immediate, life-preserving action, starting today? This right here is the most hopeful, most important message I can leave you with. Even if a test comes back and shows some early damage, those first protein leaks, it is not a life sentence. With focused, aggressive care, you can dramatically slow down and, in a lot of cases, completely stop the progression of this disease. You can preserve your kidney function for decades to come. So I'm just going to ask you, straight up, when was your last kidney screening? And did it include both the urine test for leaks and the blood test for function? If you don't know the answer, or if you know it's been more than a year, your first action item starts right now, the second this is over. Call your doctor and schedule those tests. You know, a single test gives you a snapshot in time, but the real power comes from tracking your results over the years. Catching a small but steady decline in that eGFR number is the whole key to early intervention. This is why tracking your results is so important. There are tools out there designed to help you see these trends, to connect the dots between what you do every day and your long-term health. My Health Gheware is one tool that can help you do exactly that. So here's the bottom line. Your future, it's truly in your hands. The real power isn't in waiting for your body to finally scream at you with late-stage alarms. The power is in proactively listening for the silent whispers that only the right tests can hear. So please don't wait for symptoms. Be your own advocate. Ask for the tests.